Hello, everyone. My name is Dan Toner. I'm the new health insurance broker for your company. And I'm here to talk about a new plan that we're going to offer on medical, hospital, medical, and pharmacy. We're going to be making a change from Oxford, who was owned by United Healthcare, but you have an Oxford medical plan that renewed in May. We're going to do a new plan starting with Aetna on July 1. So we're going to conduct a new open enrollment. Um, on the screen, you can see for me, you can see the memo that I've created, and EFAT is going to help us hand that out. Couple things, I'll go through the memo as quick as I can. The health insurance plan is available to those working 30 hours or more. There is a 1 month waiting period for new hires, and then you can enroll on the health plan. We're offering 3 new plans from Aetna. What's important is all of the plans have nationwide access. So New York, New Jersey, Pennsylvania, Connecticut, Florida. Aetna's network is United States, all throughout the United States. All the plans have 100% coverage. That means no deductible, no copay for your annual well visit. All the plans have in and out of network coverage. Sometimes plans are just in network only. These have in and out of network. It's called a point of service. You are not required to get a referral to see a specialist, so you don't have to go to your primary and get a permission slip to see a specialist. You do right to a specialist. And we have 2 new low-cost plans. One is HSA compatible, meaning you can set up the health savings account, bank account, and then a richer option available. So out of those 3 plans, we're not touching the United Healthcare Dental and Vision. Those plans renewed in May. So we're just going to leave those. So I'm going to try to blow this up a little bit and give you a brief summary. At the bottom, these are hyperlinks to give you the full SBC, the full summary of benefits, about 9 or 10 page document for each item. So what you'll notice, these are the monthly totals. You'll notice that some of these totals should be less than the Oxford, which was one of our primary reasons we want to go with Aetna. Plan 1 is very unique. Oxford doesn't have anything like this, so we kind of like this new plan. Primary care, you pay nothing for sick visits. Now, I know well visits are free. That's once a year, but if you get sick and go to your primary, you never pay with Aetna. If you go to an urgent care center, you pay 0. The deductible is waived. DW means deductible waived. Urgent care centers are not in the emergency room. That's a different cost. Urgent care are those Med-Emerges, City MDs, the urgent care centers. You go there, you pay nothing, and generic drugs are 0. Everything else is an $8,150 deductible, which is also your out-of-pocket. So if you go to a specialist, you owe the Aetna discounted rate in the form of an $8,150 deductible. If you take name brand drugs, it's part of your $8,150 deductible. If you go for hospitals, surgeries, and MRIs, it's an $8,150 deductible. And then that's your out-of-pocket. Maximum out-of-pocket is that same $8,150. Basically, the worst case one person in your family could spend is $8,150 during the calendar year. So we think this is a great plan for those that don't go to the doctor too much, that are looking for savings and premium. And not only get your well visits for free, but you got primary free, urgent care, and generic drugs free. So it's a very unique plan we're using as our sort of our base plan. Excuse me. Proposal number 2, for those that want a high deductible health savings account, an HSA is a bank account. You need to have a compatible medical plan before you can go into a bank and open up an HSA. That's an IRS endorsed product that says if you have a high deductible, meaning you can't have free anything except for well visits, you have to owe a deductible for primary, drugs, hospital, surgery. Then you can go to a bank and open up an HSA and put pre-tax money away. Some of you have an HSA plan today, so we're going to continue to offer one for those that really like the bank account. There's a $6,500 single deductible, a $13,000 family deductible, and then you're required to pay a percentage afterwards, and here's your maximum out of pocket for single and family. Again, low cost premium. It's a little higher because it's got a less deductible, but it's HSA compliant. If you're not interested in the bank account, putting pre-tax money away, go with plan number 1. Plan number 3 is to accommodate those that want a rich plan. In other words, you have a primary care doctor copay of $25, a specialist copay of $75. You have a $75 urgent care copay, and if you notice at the prescriptions, anywhere from $3 to $10 for generic. $45 is called preferred name brand, and $75 is the copay for non-preferred. Specialty drugs, super expensive drugs, have a $250 maximum, but other than that, it's basically a $10, $45, $75 program. That's different than having it part of your deductibles like the first 2 plans. So it's a richer plan. For your things, for major claims like hospital, surgery, and MRIs, like in imaging, you have a $2,500 deductible, and then you owe nothing. So this is by far the richest plan. You can see it's going to cost you a little bit more. And I think this price is better than the Oxford plan as well. So those are the 3 plans. Continuing with the memo, I've given you a little verbal description and just a little reminder about the dental and vision. How you access your doctors, I have it right on here. There's a hyperlink. You don't have to log in, but you can continue as a guest. And what you're going to go is to the 3rd section down. You can put in your zip code, and you're going to choose the Aetna Choice POS2. That, by the way, is their largest national network offered. So you're getting a large network, okay? This is just a reminder about United's website for your dental and vision. And on the last page, you will see from me, we are doing your contributions using Section 125. So you're not paying taxes. We're taking that out of your paycheck pre-tax, your premiums. There's a compliance notice, CHIP for Children's Healthcare notice, and the exchange notice. This is Aetna's customer service. This is United's customer service. And this is me, Dan Toner, and how to contact me and my team. So I look forward to working with you guys. We are going to conduct open enrollment from Monday the 20th until Friday the 7th of June. It's important. The more people we get, there's a possibility that the Aetna rates will come down. So this is based on the folks that are enrolling. These premiums are based on the folks enrolling today. So the more people, generally these rates will come down. I look forward to working with you guys, and have a great day.